the privilege of introducing pharmacist slash, would technically call her Dr. Irene Hogan. She's an international pharmacist of over 40 years and has won many awards for her exemplary service in women's health. This includes the Canadian Pharmacists Association in 2005 Patient Care Achievement Award for a specialty practice, and then the Distinguished Practice Award from the Ontario Pharmacists Association. And she's going to talk about today hot chicks trying to stay cool, which is dear to my heart and a bunch of us in our 50s and up. And then what you don't know about Irene is she played water polo in university, and her favorite song, at least the one she told us, is I Am Woman by Helen Reddy. So that is a classic, and take it away, Dr. Stronczak Hogan.
Hi, everyone. Can you hear me? Can we put a thumbs up?
Thumbs up.
Good. Okay. So welcome, everyone. And I'm going to give you some, distressing facts and that, but I hope at the end of it, you'll see how you can not only thrive through menopause and survive. So I've been passionate about women's health for over 20 years, and that's what I've dedicated my life's practice to, is working with menopausal women. But let's start with, menopause. What does that conjure up in your mind? So if you want to put in the chat, let me say, what are most of you thinking about menopause? What does it bring up? For some women, it's that distant concept that's reserved for our mothers or grandmothers, right? Or maybe for some of you, that are over 50, you're going to tell me, I've been there, done that, been through it, so I'm not worried about it anymore. And I have some information for you guys to up. And then for some of you younger women that are in the audience, maybe you've heard about perimenopause, but you brushed it off. You thinking, I'm too young with that. I'll deal with it when I'm older. Well, guess what, ladies? You're not alone in what you're thinking about it. And you're definitely not crazy. And it's definitely not all in your head. But unfortunately, for women still in the 21st century, it's a topic that's often shrouded in silence, or we just meet it with a collective sigh of resignment. And what can we do about it? So let's start off with a funny meme. Ladies, have you heard about the 7 dwarfs of menopause? Let me introduce you, and some of you may have met them already. There's itchy, there's bitchy, there's sweaty and sleepy, there's dopey, forgetful, and then there's all dried up. And let's not forget about their 2 rather annoying cousins, leaky and frigid. And I think that sums up, some of the laundry list of symptoms that many women not only expect, but go through when they go through menopause. And so, you know what? Fear not, ladies, because today I'm going to shed some light on this topic. And hopefully I'm going to arm you with some education, some knowledge, so that I can empower you and all women to take control of your health and your well-being during menopause, and convince you that it's not all doom and gloom. But first, let's start with some really surprising statistics. When interviewed, there was 90% of women were never educated about menopause. I mean, can you think about that? The vast majority of women that go into menopause are left to navigate these choppy seas of menopause without a compass, or without a map. And so they really are consulting Dr. Google, they're consulting, the local influencers on TikTok and Insta, and that's where they're getting their information from. And then here's another startling statistic, that over 73% of women don't treat their symptoms simply because they don't know that they can. It's like we're living in the dark ages, really, are we still burning women at the stake for witches? And it's quite interesting that many of the women that were persecuted as witches in the 16th century witch craze were over 50 and exhibited signs of menopause. So when you think of witches and, the old crone, we're not considered like glamorous. We're bony, we're wrinkled, we're shriveled up. And probably that's a sure lack of sign of estrogen, okay? And that may seem funny, but I think that stigmatization of women as we age and we go into menopause doesn't add to us feeling confident about going into that next stage of our life. And, it's 80% of women will exhibit signs of symptoms of menopause. They exhibit up to 7 symptoms that can last up to 10 years. So where before we were told, oh, this is just nuisance, these symptoms are going to go away, that is no longer, sufficient for us to be telling women. And yet many women feel unprepared, they're unsupported. Women come to me and tell me that they've literally been told, this is a normal part of aging. You just have to live with it, suck it up, buttercup, right? These are trivial and it's not going to affect you. It was unfortunate. They did a research of doctors in the United States, and they interviewed interns and residents, but also obstetricians and gynecologists, which you would think would have expert knowledge and be confident about dealing with menopause. And unfortunately, only 7% of them felt competent in treating a menopausal woman. That's a shockingly low number considering the importance of this stage in a woman's life. And so, who are the other women visiting? The other 93% of physicians that don't feel comfortable, that have not been educated how to deal with the woman that walks into their office with a laundry list of symptoms that they're experiencing. So here we are as we transition into menopause, which is one of the most significant transitions we go through apart from puberty. There's no support and there's no guidance. And so is it any wonder that as women, when we go to our healthcare providers to try and seek help, that the number one thing that women tell me is they feel dismissed. They feel that they haven't been listened to, so they feel like they've been ghosted. They're not validated with the symptoms they're experiencing. And so also we know, as I say, the stigmatization, some of the negative symptoms that women at this certain age are going to exacerbate these feelings. And so often when women do go to their doctors, they're told, this is no big deal. And often they're offered platitudes rather than real solutions because those doctors are not knowledgeable about menopause. And maybe they get a prescription for a sleeping pill, an antidepressant, an anti-anxiety pill, or maybe still women in their 50s are being put on birth control pills. And honestly, although those medications may help women, temporarily with some of the symptoms, it's not addressing the underlying hormonal changes that we're going to discuss. And so I think sometimes, doctors really in that 5-minute appointment and you're only allowed to discuss one symptom, really all they want to do is stop women complaining and get them out of their office. And while there are definitely good doctors that are dealing with menopause and menopause practitioners, there are many women that really feel dissatisfied with the service that they're getting. And let's not forget, it's not just the physical symptoms that women are going through. It's a journey that involves both emotional and psychological changes as well. But you know what? Let's first back up a bit. Let me explain to you exactly what menopause is, because some of you may be asking, and some of you may not know whether you're in it or not. And in simple terms, it's just the cessation of menstruation. Your period will end. And the official definition of menopause is that we've gone 365 days without a period. So bad luck, ladies. If you go 265 days without a period, you're considered not in menopause. But you are in perimenopause and you still can have symptoms. And perimenopause happens to women in their 30s and in their 40s. So their hormones are already changing, they're erratic, and they're still experiencing symptoms, and they don't realize that. But let's think about it. It's not just about our period stopping, and it's not about just the end of our reproductivity. And hopefully it isn't the end of our productivity for us women that are in our 60s and beyond and want to still flourish. But it's a whole hormonal shift. So again, we have this myriad of symptoms, things like hot flashes. If you're living in Europe or the UK, they're called flushes. Then you have chills. We have night sweats that keeps us awake at night. We have mood swings where we have no idea what's going on. 90% of our friends and family want nothing to do with us. We have that weight gain, that typical what's described as a menopause around our waist, and we wonder where that came from. We don't recognize our body. We don't recognize ourselves. And often many women will lose confidence during this period too as well. And then we could discuss the decreased libido. But let me look at some of these symptoms and that too as well. As I said, the average age that women normally go through menopause is around 52. And then, as I say, perimenopause is about 10 years before that. So in your late 30s and 40s, you're not ovulating every month. You will see a decline in some of your hormones. So you may get symptoms, but then they may go away because your period comes back. Your periods may get heavier. They may get shorter. They may lengthen. And then you start to miss some periods too as well. So this is all start of your ovaries starting to basically, you only have a limited number of follicles and those are dying off and we can no longer reproduce. And for some women, this is very significant to them, very sad for them too as well. So as I said, hot flushes, whatever you want to call them, they chill the body. Our thermostat basically in our brains is out of kilter. So we go into a hot sweat at a lower temperature. And, this can really disturb people. Like women are often having hot flashes hourly. If you're trying to work, if you're in a CEO of a company or trying to give a presentation, or even if you're working a regular job, imagine what that's like to have these hot sweats and that you're sweating continuously and you have no way to cool down too as well. And telling women to dress in layers is really not a very good and suitable advice to be giving to them. Our sleep will change. So we'll find that we'll have problems falling asleep. We'll have problems staying asleep. So women are waking up at 3 o'clock in the morning, and then those night sweats are not helping too as well, because we saturate our clothes and we saturate our bedclothes too as well. So we have disturbed sleep. And that is often due to progesterone, which is decreasing, and progesterone affects GABA, which is a neurotransmitter that is calming. And also as estrogen goes down, then we get more of those hot flashes and night sweats, and that leads to disrupted sleep. And when you have disrupted sleep, you wake up in the morning, you can't think well, you can't make decisions well too as well. And then mood changes. As I said, women can go from angry to overwhelmed. They have anxiety. They have the start of panic attacks that they've never had before for the first time, which often leads them to end up in the emergency room. And then we have bouts of crying, and we wonder why we're crying for absolutely nothing and not just sad movies. And then let's talk about another taboo subject. Unfortunately, I was once on a radio show and I suggested that we talk about vaginal dryness, which is a very common symptom with women, and most women experience it as they go through menopause, normally in the later years, but some women on birth controls can also get vaginal dryness too as well. And the co-host, which was a male, said to me, could you find another word for the word vaginal or vagina? And I says, like, what would you like me to call it? So I think we ended up calling it your lady parts or something, or down below. But that's, often on Facebook, we can't write about the vagina. We can't tell women what's happening to them. But basically, what's happening in vaginal dryness is that as estrogen declines, it causes the vaginal lining and also the vulva and the labia. They become thinner, our vaginal secretions decrease, and this causes irritation and increased urinary tract infections. And basically think of it like the wrinkling on your face is what's happening down in the vulval area in your labia and your vagina. And this can lead to painful sex. And then these symptoms can also worsen because we don't tell women about vaginal health. We don't tell them how to take care of that. And it's important for all women, not just if you're in a relationship where you're having penetrative sex. And so what do you need to do about that? You need, for one thing, to be using a vaginal moisturizer. So moisturizers are different than lubricants. Lubricants make things glide. Moisturize. So as we go, as I say, the same in our face, it wrinkles, our collagen decreases as estrogen decreases. We need to moisturize those tissues too as well. And so you need to use a moisturizer that doesn't have parabens in, doesn't have propylene glycol in, is pH balanced for a woman, has no glycerin or additives. And then to that, we can often add some vaginal estriol. Again, another patient came to me the other day that had been having frequent urinary tract infections. She went to a doctor. She kept getting antibiotic after antibiotic. She was in her 60s, and the doctor never asked her about her vaginal health. So after we gave her some probiotics, because she was on antibiotics continuously, I advised her to use a good vaginal moisturizer, and we also got some vaginal estrogen, which cured up the urinary tract infections, and she didn't have them anymore. And it also helped with her sex life too, as well. And then there's weight gain. We know as we go into menopause that we lose our muscle, our metabolism changes. So sometimes we have to look at what we're doing there too, as well. We also have to look at other hormones like cortisol and insulin, because we know when women are in menopause that they're also at increased risk of diabetes. And then let's talk about brain function. I have many women that come to see me that are concerned that they have early dementia because of the effect of hormones that have on the brain. Both progesterone, estrogen, and testosterone have a role in function. So our brain literally changes, and we have that brain fog. How many of you are constantly looking for where you put your keys? Or women tell me, okay, I went to the fridge and found my glasses and I put them in the freezer section. You know, we just do things, and it makes us think that our brain is deteriorating. And of course, as women, we have that fear of Alzheimer's too, as well. But you know what, ladies, I don't want this to be all gloom and doom. And we're not going to let those symptoms hold us back. You know, we can find solutions. So whether it's simple things like mindfulness, cognitive behavioral therapy, exercise, and the more that you are in self-care and take care of yourself now, no matter what age, then the more easier it's going to be for you to go through menopause. And you know what? There's nothing wrong with a good old-fashioned girls' night out, and maybe Deb, you can provide the wine. Because, you know, ladies, when life gives us hot flashes, we turn up the AC and we keep on shining. So let's have a look at some of those other myths. You know, this myth that we lose signifies the end of a woman's vitality or sexuality. I think that a lot of women on here, myself included, to tell you that couldn't be further from the truth. And, you know, the fact that we're meant to fall apart as we age and our value is diminished with society absolutely is another myth and taboo that we should be getting rid of. So let's talk a little bit about treatment options, how I work with my patients. So first of all, as I said, we do have to have a holistic, you know, whole body approach to menopause. Definitely diet and exercise and nutrition is going to help with menopause. You know, stress management techniques, regular exercise, those can fill in some of the gaps that are happening because of these hormonal imbalances. And as I said, the better health you are, then it has been proven that the less symptomatic you are going to be going into menopause. I do test. I think testing is crucial. Test, don't guess. You know, when we treat thyroid symptoms, we definitely test your levels. And those can be done in various ways. So you need to find a menopause practitioner who's experienced, whether it's blood, whether it's urine, or whether it's saliva. And don't forget, we're not just looking at hormone levels. We're looking at things like nutrient deficiencies. Many women that come to see me are deficient in things like B12, magnesium, vitamin D. All these play a crucial role in our experience menopause. And then let me give you a couple of herbal remedies. I like herbal remedies. I was trained in them in the UK, which is where I graduated from pharmacy school. And there's things like Vitex, there's things like black cohosh, there's things like maca that can help support that hormone balance. However, don't expect herbs to be working straight away. It's going to take 2-3 months. And absolutely, you know, if you're on other medications than that, yes, herbs are generally natural, but they still can interact and give you side effects too as well. So we need to look at that. And then most of those recommendations are without a prescription. And even those tiny changes in diet, in lifestyle, in movement can help. But, you know, sometimes we need a little bit more help. And sometimes we can't make those lifestyle changes until we've done other things. So we've mentioned that some women can use antidepressants, and they are used off-label to help sometimes with hot flashes, how they can do a number on our weight gain, and they definitely don't improve our libido too as well. So let's talk about another, you know, taboo and myths about which many women have fears, and that's bioidentical hormone and hormone replacement therapy. So what are we doing? We're replacing the hormones, not to the level when you're younger, but to a level where we can treat symptoms, okay? And we're not just managing the symptoms of menopause like vaginal dryness, hot flashes, and those mood swings and depression. We also know that it is important because many women are scared of using hormones. And in fact, even when they see doctors, doctors will not bring up that subject. And it's vested in some really dated research that was done called the Women's Health Initiative, which is now 20 years old. And basically what we learned from that, and we have now discovered it was the wrong hormones, so synthetic estrogens, synthetic progestin used in the wrong aged women. Most of them were either smokers, overweight, had uncontrolled blood pressure, and they were older women. And that's not the population that we're normally starting hormone replacement therapy in. And so, yes, women are concerned about breast cancer, and I understand that. It's a very emotional topic. But women are often not aware that cardiovascular disease is the #1 killer of women. And we now know from recent research that definitely women have decreased mortality, so we don't die as early. And we decrease the risk of things like cardiovascular disease. We decrease the risk of things like dementia, and we definitely decrease the risk of osteoporosis. So for some women, you need to decide what your plan is for menopause too as well. And also, you know, breast cancer, as I said, is a very personal journey for some women in that too. And I'm not recommending hormone replacement for everybody. It's neither a no or a yes. We need to be aware of the risks and the benefits. And in fact, all of the organizations, both in Europe and America and Canada, now say that benefits outweigh risks for women, for most women going through menopause. As I say, not just to treat symptoms, it's about quality of life. But it's also about disease prevention. For those women that said they didn't have symptoms, your body is still changing. You are at increased risk of things like cardiovascular disease and osteoporosis. We also now know and have discovered that women that have more severe hot flashes and frequent hot flashes is also a risk factor and a sign of health degeneration. It's a sign of cardiovascular disease and that our blood vessels are actually aging too as well. So I think we need to be opening that conversation. It also can help with weight gain and metabolism. It can definitely help with that lack of sleep too as well. So I think we need to educate our physicians and our healthcare practitioners. And as I say, come to, you know, the 21st century about the modern research that's being done. And even in that old study in the Women's Health Initiative, women were not told. It was sensationalized, you know, increased breast cancer risk, increased death, increased cardiovascular disease. But we weren't told that the women that were on that synthetic estrogen still had a decreased risk of cancer, breast cancer specifically. And you're also not told that, you know, if you gain more than 10 pounds of weight, if you're not sleeping at night, if you're stressed, low vitamin D levels, these can all, and alcohol, like, you know, as I say, I like the odd glass of wine, but alcohol can increase the risk of breast cancer. So you need to know your individual risks. So basically what I'm going to say is that we really need to open this conversation. We need to provide a forum. We need to provide them with resources. And so that's one of the things that I'm going to be gifting to you. You will get a downloadable copy of my book. And my book is called Hot Chicks, Hot Sex, How to Survive Menopause. And so it's not just about sex, lady. I'm offering you practical advice. I go through personal stories from the patients that I've worked with. And it's that help, okay? It's for that ship that needs that map. It's a guide for navigating this transition with both grace and confidence. And one of the stories that I tell in the book, which is, to say, quite interesting, I had a woman that came to see me about low libido and low interest in sex. She had a loving partner. You know, she still loved him. She was interested in it. And she was in her 50s. And she went to see her family physician. And her family physician, after listening to her, said to her, I suggest you listen to classical music. And you know what? Classical music, it was not just being suggested as foreplay. So she politely suggested to her doctor, Is that the information you would give to your wife? And I'm also thinking, for men suffer from erectile dysfunction. We have this little blue pill and everything. And there's no fear of saying to them, oh, yes, let's give you a prescription for that. And yet, can you imagine if we told men that it was all in their head and maybe they should listen to classical music? So that's how women are treated. Again, she came to see me. We tested her testosterone levels, which is another hormone that we don't talk about, and many doctors are uncomfortable prescribing for women. And I can tell you that it's all good in her sex life now too as well. So, ladies, let's say menopause needn't suck, okay? I'm hoping that I've convinced you it's not doom and gloom. We can be productive. We're going to spend at least a third of our life in menopause. So we need to unlock the key. We need to discuss all these myths and taboos that surround this natural transition. Yes, menopause is not a disease, but every woman is going to go through menopause. There's this stage of their life. The teenagers of today know more about puberty and delivering babies than women know about when they go into menopause too as well. And so it doesn't have to be a grim fairy tale. We can ignore all those 7 dwarfs of menopause. And definitely women should not suffer in silence. As I say, it's not a disease, but as women go into menopause, they definitely are at increased risk of things like cardiovascular disease and diabetes and dementia and osteoporosis. So, I want to leave you with some final messages. Let's embrace menopause truly. I'm living proof that we can survive menopause and have a vital and healthy life. We want to emerge from this journey, stronger, wiser. We're a group of vibrant women. And let's, take this transformation and let's open up the conversation. We need a community of women that are talking about this. We need them to say to their healthcare practitioners, I don't think that's current research. We sometimes need advocates for our health in this area. And it really is a time of, as I say, not only surviving, but thriving. We need to ask for help and we need to form a community. Whenever I have women's health nights, those women, it feels like even though these symptoms are normal and they're occurring, they realize that other women are going through that too. And that's what we need to do, is have a community of women that are talking about menopause. So remember, we're not defined by our age. We're not defined by our hormones. We're defined by the strength, the resilience, and the wisdom that we bring to this stage of life. A community of women that can feel normal when we can talk with this out in public. And so I want to leave you with a couple of quotes. One is a well-known one of Maya Angelou. So she said, I am woman phenomenally. Phenomenal women, that's me. So I want this to be a time for you to shine, ladies, right? We can do this. It's our time. We should claim it. And then another is a quote that my mom gave me, who is no longer with me. And she basically said to me, we all need to be women of altitude. So women, let's rise up. Let's embrace this stage of our life. And let's no longer say that menopause sucks. Thank you, ladies.